This is one of the most memorable cases I've seen in residency. It's a patient that came in with a broken neck and they were hunched over forward from what's called a kyphotic deformity. To fix this, we had to put the patient in a traction device. We apply weights to a pulley system that's attached to a ring that goes on the skull, and this will pull on the spinal column to try to straighten out this deformity. After this was done, we took the patient to the operating room where we went in through the front part of the neck, and we had to perform what's called a cervical corpectomy. This is where we remove an entire block of bone from the spinal column. We then fill that space with an artificial spacer that is either made out of titanium or some sort of cadaveric donor bone. And this is what the scan looked like after the first stage surgery. We then sent the patient out intending to do a second stage surgery where we were going to fuse the back part of the spine. But shortly after release, the patient actually fractured their neck again at the level above the place where we did the surgery. The patient was then placed in the traction device again to try to align the spine. And once that was done, we took the patient to the operating room and performed a posterior cervical fusion. This is where we put titanium screws and rods in the back part of the spine to keep it in place after we put it in its proper alignment. And this was the scan that was done after that surgery. You can see that now the spine looks like it's back in its proper alignment, and the patient actually did exceptionally well after this surgery.